I'm Lauren Shapiro. I'm an affiliated faculty member of the Philip R. Lee Institute for Health Policy Studies. I'm also a hand and upper extremity surgeon in the Department of Orthopedic Surgery at UCSF, operating primarily at the Orthopedic Institute. I operate on a variety of elective and traumatic hand and upper extremity conditions. From a big picture perspective, I'm interested in understanding how to ensure that all patients receive equitable, high-quality surgical care. My research interests involve a broad range of topics, including healthcare quality and value, understanding patients' preferences and integrating these into shared decision-making discussions, and health equity. Most of my research focuses on one of these topics or works at their intersection. Working through each of these, as our healthcare system transitions to focus on quality and value, it is important to understand how and from whose perspective we understand and define quality and value. While things like lack of infection and appropriate delivery of antibiotics are important, it's also foundational for us to understand and ask patients how they're doing. Ultimately, as we're providing care to patients, it's important to ensure that their voice is heard and taken into account. Similarly, I'm interested in how the patient voice and perspective can be utilized in shared decision-making processes. Healthcare has traditionally been a paternalistic system. However, there's growing evidence that patients want to be involved in their care decisions, and that incorporating patient views can lead to less decisional conflict and other beneficial outcomes. Our lab is working on how to understand and incorporate patients' preferences and values into shared decision-making discussions to align treatment decisions with patients' values. Lastly, I'm interested in understanding quality and value and shared decision-making utilizing a health equity lens. Our lab has conducted work evaluating factors like insurance type, race, patient preferred language, and their association with factors like time to surgery, type of care received, complication rate, and outcomes. Notably, many of these social determinants of health have strong associations with these outcomes, and our next steps include understanding why and utilizing these findings to inform interventions. We're trying to work on understanding issues and making change at multiple different levels. From within our own UC system, understanding how to deliver preference concordant care, and understanding access to timely care. As the use of health IT expands, understanding how to capture the voice of all patients postoperatively, as opposed to those who just speak English or have easy access to transport, etc. From a national perspective, we're working with our professional societies to understand how to best collect data in an inclusive way, how to understand the equal application of our quality measures and clinical practice guidelines as well. From an international perspective, we've developed consortia of policy and surgeon experts to help develop and validate quality measures for basic surgical care that can be utilized all over the world. We're trying to approach these topics in a variety of ways, from big data to quantitative cohort studies to qualitative semi-structured interviews and using modified Delphi processes.